Okay, I'm checking to make sure the scene is safe for me and for my partner. Are there any bystanders from which to take a sample history? I don't see any. So I have my proper BSI on, and it looks like we have patient female in her 30s, unconscious. Doesn't look too good. I'm going to have my partner come over here and do manual C-spine stabilization, and we're going to check for responsiveness. Are you okay? Are you all right? There's no verbal. Now we're going to check for any stimulus to pain. I'm going to squeeze the trapezius. Okay, the patient is unresponsive. Okay, it looks like we do not have adequate airway, so I'm going to do a modified jaw thrust maneuver here. I'm going to have my partner come in and size and place oropharyngeal airway. Does the patient accept? Okay, so now we have an airway, so let's look, listen, and feel for breathing and chest rise. All right, breathing seems inadequate, so I'm going to have my partner also bag valve mask this patient with 12 to 20 breaths per minute with supplemental oxygen, and then we'll reassess that breathing here in a minute. So let's we're going to check for circulation. Do we have a central pulse? Okay, we do. And do we have peripheral pulses here at radial? And we'll check for a peripheral pulse here. We do, and we're checking the skin to see if it's warm, pink, and dry, or cyanotic, cool, and clammy. And we're looking for any severe bleeding, and okay, and we don't see anything there. So on my initial impression is that this will be a rapid transport, so we're going to get an ambulance on the way with ALS intercept or a notification to a trauma center depending upon our location. And we're going to begin our primary assessment. So we're going to start up here at the head, and we're checking for any bleeding and deformities, any step-offs, any JVD or tracheal distension or deviation here. Okay, we don't see anything. I'm going to have my partner put a collar on this patient, get her sized with a collar, and we're going to continue here. Okay. This time we're going to check for lung sounds in 2 locations. All right. And we're going to check the sternum right here, and we're going to continue to expose as we go down through here. We're going to check the sternum. We're going to check for the chest here. Is everything intact? Do we note any crepitus, any bruising, any decap, BTLS? We're going to check the quadrants of the stomach for rigidity or any tenderness. Okay, we're going to check the pelvis and the hip region. Do we see any crepitus? Do we sense any wincing or anything here? Okay, we're going to come down the legs. Any deformities? Anything that looks like a major fracture? Do we see any bleeding? And we're going to check for peripheral pulses here at the posterior tibial and also at the dorsalis pedis. Does the patient have a Babinski reflex? I'm going to do the same thing on the right leg here. I'm going to come down. Do we see any bleeding, any deformities? And we're going to check these distal pulses as well. And we're going to check to see if the patient has a Babinski reflex there. And while we're down here, we're looking to see if there are any bracelets or anklets or any medic alert tags. I'm going to move back up here to the arms. I'm going to check this arm right here. Is there any fractures, any bleeding, any decap, BTLS? I'm going to recheck this pulse right here. And we're going to have this pulse noted along with the other vitals. We're going to check for tenting, indicative of any dehydration. Okay, and we're going to check right here for any cap refill, and we're still checking now the right extremity for any bleeding, Any fractures to note? Okay, any dehydration noted? Or cap refill? At this time, my partner is here with the longboard, so we're going to roll this patient away from us. At this time, we're going to check the posterior. Do we see any deformities here? Do we see any bleeding, any bruising, any decap BTLS to note? Okay, we're going to roll the patient back down. So now this patient is ready to load onto the ambulance, and now that we are en route, we are going to begin our secondary assessment. Just a more thorough assessment. We're going to start right up here at the head in the cranial region, and we're going to check the eyes to see if they're check pearl here. Are the pupils equal, reactive to light? Do we see any raccoon eyes or anything? We're checking around the nasal bones here, and we're checking the maxilla and the mandible. Do we see any fluids or any blood coming out of the ears? Any bruising behind the ears or battle signs, anything indicative of a basal or skull fracture? And we're looking through the collar here just to see if there's any changes in JVD here, and we're double checking here just for any kind of a necklace or any other medical alerts that we might have missed in our primary. And then we're going to move our way down. We're going to check for lung sounds again to see if our assisted ventilation is doing what we want to do. We're going to check lung sounds in four regions. See if lung sounds are clear. And do we have bilateral expansion of the chest here? Okay, is the chest cavity, is everything intact? And once again going to check the quadrants. Is there any change in tenderness, rigidity here? Anything to note there? And we're looking again here for any crepitus, any wincing. Okay. And in our left lower extremity, we're checking again to see if there is any changes in that. Any change in peripheral pulses? Do we have a Babinski reflex? I'm checking cap refill. Okay, we're doing the same thing here on the right leg. Any changes here? We have peripheral pulses. Do we have a Babinski? Do we have cap refill? Can you pull there? Can you push? Can you pull with this? Can you push? Do we have any responses there? Okay, now we're going to come up here to the left upper extremity, and we're checking the arm here, rechecking. We're going to see if there's any change in the pulse here. We're going to check for any tenting or any dehydration signs in this left arm. And cap refill, can you squeeze my hand? Okay, this arm is clear. So what we're going to do is get a blood pressure reading. We're going to put a cuff on this arm. Okay, and we're going to have that blood pressure recorded with the rest of the vitals, and we're going to move over to the other arm. Okay, no decap BTLS here. We're checking for pulse, any changes in pulse here. Do we see any tenting? Checking cap refill. Can you squeeze my hand? Okay. All right. So what we're going to do with this patient while en route is we're going to recheck vitals on this patient every 5 minutes.